choose the perfect nursing specialty? Well, you don't. The perfect nursing specialty chooses you. Or you may find out that what you thought was the perfect nursing specialty is not the perfect nursing specialty after all. Nursing rotation shows you an entire new perspective. So really quick, I want to be brief with your time today and share with you that, you're thinking about nursing school and you've already decided that you have the perfect specialty in mind. You're so super excited, you're about to start nursing school or you're in nursing school and you cannot wait to that clinical rotation. But as you begin to navigate through nursing school, you begin to do your research and you may have some questions. And then throughout your nursing rotation, you finally get into that area of specialty or maybe something similar and decide, I don't know if this is what I expected. But then listen, something also happens in nursing rotation while nursing school. As you begin to go through the different areas of the body and nursing clinical, you may find yourself falling in love with a nursing specialty that you would have never thought in a million years that you would even have thought about. And that's similar to my situation. I don't know where I got in my head that I want to be a neonatal nurse practitioner. That was my thing. I had got down to maybe my senior year, and I'm like, I want to be a neonatal nurse practitioner. You couldn't tell me nothing. For one, it sounded cute. It sounded good. I used to babysit back in the day. I remember going to the babysitter's workshop. I had a babysitting certificate back in the day. Loved it. Loved kids. Loved babies at the time, as long as they weren't mine at the time, because again, I was going to college. I was very selfish with my time. And my grandfather, he was like, well, that's an area that you really want to think about. He's like, a lot of detail goes into that. He said sometimes there's a lot of lawsuits in that area with dealing with infants. So I was just like, okay. So finally got into nursing school and started my clinical rotation. And I believe it was my last, not that I believe, it was my last clinical rotation of nursing school. And it was the CVICU, me and another nursing student, and we're friends to this day. And we absolutely fell in love. Cardiovascular cardiovascular intensive care unit, CVICU, fell in love with that area, the intensity of and the complexity of the patient care assignment. I just loved every bit of it, learned a lot. And we'll go over that area of specialty in another video, but just wanted to share with you that I surprised myself. And I don't know, and it's like when I did go through the clinical rotation and it was pediatric ICU, it was a lot. It was devastating. That's another story that I'll talk about, but it was a lot and it was not what I expected. And saw things, hurt my heart. It was just a lot. And that is all that was like all those years. I thought that's what I wanted until I experienced that clinical rotation and then got into the CVICU. And right after I graduated college, nursing school, I found a similar job. It was cardiac special care step down unit, and we shared a floor with ICU. So if our patients got so sick or they had certain requirements that had intensified, then I would just take them right next door. And then vice versa. If they were, coming out of the ICU, and especially if there was cardiac special care, they would come right to my floor. So I enjoyed partnering with those ladies over there. But absolutely, again, loved the step down cardiovascular step down unit. We prepared patients for open heart surgery or a vascular type of surgery. We got them back from surgery. We also had, because I mentioned cardiothoracic, so we also had patients that had lung cancer to where they had different areas maybe of their lungs removed, so lobectomy. It was intense. You had some people that were there that were younger people. I'm like, what are they doing here? And they had gotten an infection from an infected tooth, and that infection circulated throughout their system and into their heart. So we had a lot of sick patients there in the cardiovascular ICU. So I just want to share that tidbit with you that sometimes that you don't choose your nursing specialty, it chooses you. And as you begin to grow in your nursing career and evolve, you will continue to see how your nursing specialty it may be for whatever reason that you may not be able to stay in that area. For example, I was a new nurse, I was night shift, I had a young family, couldn't really stay on that shift. Even when I wanted to go to the first shift, it was packed and loaded. So I had to go to another area of nursing that really best suited my lifestyle and young family. Just wanted to share that with you. And sometimes I feel like that when you find yourself going against the grain in nursing, having a tough time for whatever reason, maybe it's the prioritization of it, the medical complexity of it, or you're just not feeling it, you're beginning to feel burnout. Those are some signs that maybe that is not the best specialty for you. But hang in there. If you're a new student, think about thing about nursing, or you are a current nurse and you're trying to find out where is my way. So just be open and have an open mindset and be willing to learn new things, and your nursing specialty will continue to evolve and find you. So in the comments below, please let me know your thoughts. Did your nursing specialty find you, or did you find your nursing specialty and you've stuck with it throughout the years? And if you want to hear more personal stories like this, please subscribe and like to the channel. Thank you so much. Until next time.